My role here is to bring you a bit the drivers of the regulation at the European level. And this is something that we at AESGP are concerned about. It's our everyday life is to monitor the regulation and the policy making that's been done at the European level, in the European institutions mostly, and try to put self-care also on the agenda a little bit. We now have a very new commission. We are also having a new president of the council. We also have an external representative, and we will have Roberta Metsola again as the European Parliament president. And so our new commissioner for health is actually Oliver Varhelyi, one of the most polemic probably in this constellation, I would say, coming from Hungary. Already we know not under a very EU-friendly political approach, but also his mandate was disputed. However, we have the same that we were expecting. He's going to continue on the European Health Union. He's going to persist on the One Health issues. And we were not sure whether the Critical Medicines Act would be his, or the parliamentarians would take it away from him, but he's going to get it. And also the pharmaceutical legislation that is the pillar of all EU legislation for pharmaceuticals, all of them is going to keep on underway. Other new things are coming from this commission, and we know this from the mission letters that they got. One, we're going to have a European Biotech Act. More intervention on the medical devices implementation, which we know is not going so well. More investment in preventive health, and I'm sure we'll have this in the discussion as well today. And the other one, we are going to keep on beating cancer and tobacco legislation revision, piggybacking on the Beating Cancer Plan. We have many products under self-care that are also helping people let go of their tobacco addiction. But that's not all. We have other commissioners and other vice presidents that are going to bring new policies into the mix. Some of them are going to impact us as industry, as manufacturers, and as innovative industries as well. I'll start actually with the one at the bottom, which is digital markets, the AI, which is also, and data, which is also the theme topic for today. But others are going to impact us, the strategy for life sciences, the Critical Raw Materials Act, the keeping on of the Green Deal that's now is going to be revamped and just called Clean Deal. It's not so longer a color. And also the chemicals industry package. So we're very concerned on the impacts of chemicals in general. And guess what? Our products are chemicals, most of them. So we will be taken on board as well. But and this is something that we always need to tell the politicians. Self-care products, self-care medicines, or also known as OTCs, are chemicals and are also pharmaceuticals. And they cannot be just put in the regulation with the rest of the pharmaceuticals. And the study that we did at AESGP was to check how much were we saving European budgets, European healthcare budgets, on missed days of work, on how much time and money you spend going to a doctor to get a prescription for a product that's actually available in the pharmacy under self-care. And this is how much we actually save. If there were no self-care products, if you would not be able to get your ibuprofen, your paracetamol, your digestive pills from the pharmacy, we would need 120,000 more doctors in Europe. Or we would need the doctors that we have now to be working 2.5 hours extra every day, all of them. And we already know that they're running short on time and running short on time to do other things and to treat their patients. And overall, we already save 36 billion euros to the European healthcare budgets. This is how much we are freeing up for budgets to be concentrating on innovative medicines, for instance. But there is a potential still to save 17 billion more. Why is there this potential, this untapped potential? Why are we not there yet? Because every country sets different self-care products. So it's still under a subsidiarity principle what products are under self-care. And here you can see in this how much the difference it is from you to taking a self-care medicine from a pharmacy or going to a doctor. And you see there, obviously, the countries, also my country is there on to the right, where it's less expensive to go to a doctor because, I mean, salaries are also lower and economies are a bit lower. But you see, it's always cheaper to go to a pharmacy, and you can always save. And here on average, you see Greece is there on the second group. You can save per intervention 13 euros to the healthcare budget, or some of your out-of-pocket. Every time you take one of the paracetamol, for instance. There's a great potential to grow in number of products. That means that could be non-prescription, but also on the health literacy of patients and consumers. And this is something we've been trying to tell the Commission, that this untapped potential is there. And when you go into the revision of the pharmaceutical legislation, and sorry for the busy timeline, but that's what it is. Now we're waiting for the Council to do their revision. This is what we need to tell them. These are the main actors now on the pharmaceutical revision. So from the side of the Parliament, the game is set. Instead of Pernille Weiss, we are now having Dolores Montserrat, also from the same party, but from Spain. She's an ex-Minister of Health. And then from the Commission, we are now having the new Commissioner, as I said. And then you see there some arrows, because we don't know when this revision from the Council is going to happen. But we predict that probably around the Cyprus presidency that might be finished. And these are some of the issues that we've been taking and telling them, look, self-care products, self-care medicines are slightly different. We need to nuance a little bit. It's not a medicine that is strictly from hospital. It's not a cancer drug, but they also have other issues. And so whenever you try to put a different prescription criteria, for instance, for AMR, and we are looking in very much into this, trying to explain it to them, you take self-care products also on board. When you do environmental risk assessments, or when you do changes into this process, you are taking self-care products on board. Whenever you put in measures to mitigate shortages, there we are. Perhaps they're not needed for some of the products, and we need to decide that some critical medicines need more measures than others. And this happens the same for the product information and labeling, and also for a lot of things that are actually out of scope from the revision, but that the parliamentarians decided to apply some changes. And then another topic that's on top of our minds, environment. It came in as a Green Deal. We are considering environment, not just the climate change, but also the impacts that our products are having on the environment. And this is coming also from a lot of legislation. And you can see that not just One Health, but also the Zero Pollution Action Act that's been taking a lot of time will now make pharmaceuticals and cosmetics to pay for quaternary treatment to remove micropollutants from water. So this is something that we're also working on how to best implement in a fair way this kind of system. It's the water, it's the air, it's the way we manufacture. Everything is coming on board in the Commission. And also, we have some key issues that I will not get in, but you see that we need to work with other industries, and I think this is something also for the future, that we work with them to implement in a fair way the legislation that's emanating from the European institutions.